Right. So, welcome everyone to the Cardiovascular Respiratory Healthcare MSc seminar, telling you about how you can join our course to acquire a master's or a postgraduate diploma or a postgraduate certificate. We're very excited to welcome you to this. We're going to take you through a description of our program, how the learning progresses through the course. A very important part of this course is your research project, which we'll discuss next. And then we'll look at what happened with previous students, what happened when they finished the course, what kinds of jobs did they go on to, or studies did they go on to. Then a lot of you are very interested in the details of how to apply, and Leanne will be covering that in great detail. And then finally, we look forward to getting your questions and answering them to help you through this process. My name is Professor Darrel Francis. I'm the course director. And with me today are Dr. Leanne Felkin, who's the senior teaching fellow, who manages the course from day to day, and Dawn Stageman, who is our course administrator, who will be your first point of contact while you are studying in this course. Today, we're also delighted to welcome Darreen Marglani, who is a previous student of the MSc course, who enjoyed it so much that she arranged for herself a PhD to follow on her research interests, and she's here in Imperial College now, studying for a PhD, and she's also available to chat to you and tell you her experiences. So the National Heart and Lung Institute is the UK's premier organisation to study, in fact, it's the world's biggest research institution for heart and lung disease. And it is a national institute in the United Kingdom. It is at Imperial College, London, and its work is carried on at 3 campuses: the Royal Brompton Hospital, the Hammersmith Hospital, and South Kensington, which is the main headquarters of Imperial College. There are over 500 staff, including numerous Nobel Prize winners, 4 fellows of the Royal Society, 22 fellows of the Academy of Medical Sciences, and every year we win competitively hundreds of millions of pounds of research grant money. It's the country's largest teaching centre for medicine and engineering together, and is the leading centre in the UK for cardiovascular and respiratory science. Currently, we have over 200 PhD students and 150 MSc students, maybe 151 if you're joining us next year. So these are our students from a couple of years back, a couple of years of cohorts of students. As you can see, they're from all over the world, and they all look pretty happy. I think if they weren't happy, they weren't allowed to be in the photograph. They're probably cropped out. But they are a mixture of backgrounds. Some were recent graduates of medical biosciences, sports science, rehabilitation therapy, nutrition, and pharmacology. We also have those who are already healthcare professionals, such as nurses, doctors, physiotherapists, respiratory therapists, and paramedics, and also allied health professionals from pharmaceutical medicine, pharmacy, and sports sciences. So why you might come to Imperial, it's actually the only UK program that combines cardiovascular and respiratory science, because we have the world's largest institute for heart and lung disease. It focuses on the clinical application of knowledge, both from our clinical research, but also from research that comes from the engineering and basic sciences team, which are very large in Imperial College. We critically evaluate up-to-date research and evidence-based practice and put it into practice in our patients, which you will see during your clinical contact time in the MSc. The aim is to combine innovation and technology to improve healthcare for patients and learn real-world skills that will enhance your career, your present career, and could be transferred should you transform your career path after coming to this MSc, which a lot of people do. A special feature of this is that you will be conducting a research project with world-class facilities and supervised by world authorities in the field that you're working in. So, Leanne, could you now take them through the next features?
Okay, thank you, Darrel. So as Darrel said, my name is Dr. Leanne Felkin, and I'm the Senior Teaching Fellow on the programme here. I'm going to spend about 15 minutes giving you an overview of the programme, where I'll tell you a little bit about how we teach and how we assess here at Imperial, and I'll talk about your research project. When you're excited about the programme that we have to offer, I'm going to outline the entry requirements for you and explain how you can apply. So the Cardiovascular and Respiratory Healthcare programme was established in 2018, and it's now in its 6th year. The programme was designed to be flexible and can be taken as a postgraduate certificate, a postgraduate diploma, or the full MSc. And our students can choose to study either full-time or part-time. Each year we have 25 spaces available. We teach face-to-face on campus, and we're based primarily at the Royal Brompton campus, but we also visit the Hammersmith campus and the main South Kensington campus. The programme lasts for 1 full calendar year of 52 weeks, and for the academic year 24 to 25, this will begin on the 28th of September. The structure of the programme is modular, with both taught modules and research modules, and it can be completed in 3 different ways: the certificate, the diploma, or the full MSc. The difference in the awards is to do with the amount of academic credits that our students complete, and most students are enrol on the full MSc, either full-time or part-time. Now, all of our programmes undertake the taught modules, with the full MSc also requiring students to complete our research project module. The taught modules are split into core modules and elective modules. The core modules are compulsory modules. There are 4 of them, and they form the foundation of your learning. We also offer elective modules, and this allows you to personalise your programme. And here our students choose 3 out of the 5 modules available. And typically we find that students choose their elective modules based on their interests, but they can also make their choices according to the types of skills that they wish to learn or the learning experiences that they want to have. And I'm going to share with you a little bit more information on our modules in the next 2 slides. So our core modules form the foundations of our programme, and they reflect our scientific and our clinical approach to study here. The Foundations of Cardiovascular and Respiratory Sciences module and the Study Design module have a more academic scientific approach, whereas Reflection Evaluation of Clinical Practice and the Quality of Cardiovascular and Respiratory Healthcare are more clinically focused. And on this slide, I've tried to summarise for you the key information about these modules, including the number of teaching days and the assessment types. And I'll just take you through these core modules one by one. The Foundations of Cardiovascular and Respiratory Sciences module is a double module. It's led by Dr. Rashida Chowdhury, who is an electrophysiologist here at the NHLI. The module covers the cardiovascular and respiratory anatomy and physiology, and we have 19 days of teaching, and it's assessed with a written and an oral assignment. Study design is led by Dr. Andre Amaral, who is an epidemiologist here at NHLI. The module will cover the principles and practice of quantitative and qualitative research. There are 8 days of teaching, and it's assessed by a written assignment. Moving on to our more clinically focused core modules, Reflections and Evaluation of Clinical Practice is led by Professor Elizabeth Renzoni, who is a respiratory consultant practicing at the Royal Brompton Hospital. The module teaches our students to critique clinical practice in relation to evidence-based guidelines and to reflect on how they can improve practice. There were 3 days of teaching. But importantly, in this module, our students attend 4 clinics from across our partner hospitals, excuse me, to observe the delivery of cardiovascular and respiratory healthcare. And the assessment for that module is a written assignment. Lastly, we have the module Quality in Cardiovascular and Respiratory Healthcare, led by Dr. Peter George, who is also a respiratory consultant practicing at the Royal Brompton. And in this module, we teach you how to critically consider the factors contributing to the delivery of high quality healthcare. This comprises 5 days of teaching, and the assessment for that module is an oral assignment. Moving on to the elective modules, we offer 5 elective modules from which our students choose 3. 2 of the modules relate to cardiovascular healthcare, and these are Innovations in the Management of Cardiovascular Disease, led by Professor Stuart Rosen, and Cardiovascular Health, Prevention and Rehabilitation, led by Dr. Kajaluxi Anathan. We have 2 respiratory-focused MS modules. These are Pulmonary Rehabilitation and Community Respiratory Care, led by Professor Nick Hopkinson, and Respiratory Failure and Respiratory Support, led by Dr. Lydia Finney. Our final elective module is focused specifically on cystic fibrosis and is led by Dr. Sumaj. Excuse me. So having introduced you to the taught modules, I'm going to show you in the next slides how these fit together across the academic year. So in this slide, I've summarised for you the MSc journey for a full-time student. The timeline shows when the different modules are taught during the academic year. So across the columns, we have the months, and down the rows, we have the different modules and teaching activities. We start in October with the core modules, Foundations and Study Design. We have 2 weeks off for the winter break, and when we return in January, our students undertake their elective modules, and the exact timetables for these modules differ. We also complete the teaching for the core module Reflective Practice, and students begin their clinic visits. There's another 2-week break before we return for the summer term, and here we teach the quality module, and our students begin their research projects. Some students may also be finishing up the clinic visits for reflective practice. For those of you interested in the part-time MSc, this is split across 2 years. In the top panel is the plan for year 1, and in the bottom panel is the plan for year 2. So in year 1, you begin the year with the Foundations module. In the spring term, you complete 2 of the elective modules, and in the summer term, you complete the quality module. When you return in the second year, in the first term, you undertake the study design module. In spring, you complete your 3rd elective module, and you start reflective practice. And finally, in the summer term, part-time students begin their research project. So looking ahead, should you wish to come and join us here at the National Heart and Lung Institute, here are some key dates. It is expected that Imperial will host its induction week from Monday the 30th of September, with teaching starting on campus on Monday the 7th of October with our Foundations module. Our final assessments are in September 2025, with the university awarding degrees in November 2025. And finally, our graduation ceremony takes place in May 2026, and we celebrate our graduates in the truly remarkable setting of the Royal Albert Hall, which is just behind Imperial's main campus in South Kensington and overlooks Hyde Park. So an important question we are frequently asked is, how will I learn and how will I be assessed? Our teaching approach on the MSc is very student-centred, and we have a multi-mode delivery. What this means in practice is that we put our students at the heart of what we do in the classroom, and we've been able to keep the best practices learnt from recent years to deliver teaching in a range of formats. We teach using traditional lectures and seminars, but we also use hands-on workshops, problem-based learning, clinical case studies, journal clubs, guided online learning, and video tutorials. We also have a wide range of experiential learning experiences, which are a highlight of the programme, and I'll expand upon those in my next slide. Our teaching is delivered by clinical and research specialists here at Imperial College and supported by a full-time dedicated teaching fellow. And finally, we assess your learning using a range of authentic formats to showcase your knowledge and skills. These include scientific report writing, oral assessments, poster presentations, case study analysis, and journal clubs. We describe these as authentic assessments, as they are deliberately designed to replicate professional activities undertaken in the workplace. And what this means is that our assessments will allow you to develop and showcase skills that you will actually use in your working life. Our experiential learning opportunities are a unique part of our MSc, which really sets us apart from other courses. Experiential learning means to learn through experience. And here we make the most of the remarkable facilities we have available in the Faculty of Medicine and at our associated hospitals to create learning experiences for our students which cannot be accessed anywhere else. And our students frequently cite these experiences as highlights of the MSc for them. Specifically, we spend 2 days at the Human Anatomy Unit at Charing Cross Hospital. Here we visit the Pathology Museum and also the Human Dissection Rooms, and this allows our students to experience and learn cardiovascular and respiratory anatomy hands-on. Our students visit the cardiac catheterization labs at Hammersmith Hospital, and they complete exercise physiology practicals as part of their foundations assessment. Lastly, we are especially pleased to be able to take our students to a scientific conference. In November, and as part of your foundations module, we visit the winter meeting of the British Thoracic Society. The BTS is the UK's premier society of leading respiratory healthcare professionals and scientists, and it's an opportunity for our students to hear research firsthand and, of course, importantly, to network. Moving on now from the taught modules of the programme to the research project. The research project is the capstone of your MSc. It's where you can apply and further develop all of the skills and knowledge that you've gained during your taught modules. Our projects are supervised by academics here at the National Heart and Lung Institute, and during your project you will become embedded within their research team, and you will be able to take part in and contribute to the cutting-edge research that we carry out here at the National Heart and Lung Institute. You will be stepping up to work alongside the academics and researchers whose work you have been learning about in your taught modules. We offer our students a range of different project types from both the cardiovascular and the respiratory fields. Our projects include clinical research, where you'll be collecting data from patients or healthy volunteers in the clinic. Laboratory research projects, where you will carry out experiments in our world-class facilities. Some students choose to do data analysis projects or systematic reviews of the literature, which offer flexibility. And students interested in improving healthcare, we offer service evaluation and quality improvement projects. Lastly, our students have the opportunity to develop their own projects alongside an Imperial academic. I'm going to move on now to talk about what happens next to our graduates. An MSc is a stepping stone for you, which can open up many different and exciting opportunities. We now have over 100 graduates from the course, and one of those, Darrel, is hopefully with us here today and can answer some of your questions. As Darrel mentioned earlier, Darrel graduated in 2022 and is now pursuing a PhD at the National Heart and Lung Institute based upon her MSc project. Being a healthcare MSc, it will be no surprise to hear that many of our graduates go on to pursue clinical careers or careers in healthcare. Each year, a number of our graduates go on to study medicine at undergraduate level or graduate level. Some of our graduates have joined the NHS Scientist in Training programme, which is extremely competitive, and they are now working as cardiac physiologists in the NHS. Our nursing students have used their qualifications to gain promotion to clinical nurse specialists or have moved to become research nurses. Some have also transitioned out of the NHS into the charity sector. Many of our students go on to do further study at PhD level, either at Imperial or at other universities. We have 5 students currently undertaking PhDs at Imperial based upon their MSc project. Other students go on to become research physiologists within UK universities. Some students move into education, and we have students working as university lecturers in the UK and overseas. And lastly, there are many opportunities for our graduates in industry through project managers, medical writing, or in areas of pharmacovigilance. So I'm finally now on to my last few slides, and I hope that what we've told you about today has tempted you into applying to study here at Imperial College. So what follows now is some key information and the next steps. The entry requirements for our programme are an upper second class BSc, which is the equivalent of a 2-1, in a medical, biomedical or healthcare subject. Our language requirements are the higher English requirement, and you also have to submit a personal statement demonstrating that the course is right for you and that you have the skills, knowledge and aptitude to achieve the course requirements. 2 academic references are also required. If you meet the first of these requirements, we do have a guaranteed interview for you. If you do not meet the programme's academic requirements, or if you are currently an undergraduate and do not know your results yet, we strongly encourage you to apply anyway, as your application will be assessed on its merits, and in such cases your personal statement can be pivotal. It may be that you do not meet the university's minimum requirements of a lower second class degree, which is a 2-2. In this event, there is a special case procedure for applicants with sufficient clinical experience. And lastly, we do not accept intercalating MBBS students. In terms of the actual process of applying, applications for the next academic year are now open. Applications must be made online, and to apply, you will have to register with My Imperial. You can submit 1 application form per year of entry, and you can choose up to 2 courses. There is an application fee, but we have fee waivers for those who are eligible. So please do contact Dawn on the MSc email for information about this. The deadline for home applications is the 1st of August, and the deadline for overseas applications is the 30th of June. We close our overseas applications earlier to allow time for the visa paperwork to be completed. In the process of applications, applications are reviewed weekly, and we hold online interviews twice monthly. Offers and outcomes are typically made within 5 working days. We do strongly suggest that you apply early, as we will close applications once we fill up. This year, we are delighted to be able to offer 1 scholarship for the MSc. This scholarship will award £3,000 towards your tuition fees, and it's available to home and overseas students who will be starting in 2024. To be eligible for this scholarship, you must hold an offer for the full MSc. The deadline for applying for the scholarship is the 31st of May, and you can find further details on the programme web pages. In addition to the MSc scholarship, there are a number of other internal scholarships offered by Imperial College. You can search for these on the college website using the search tool. You will need to filter by selecting postgraduate taught courses and choosing National Heart and Lung Institute as the department. Please do check the application deadlines for the scholarships and also the eligibility criteria. And this is my final slide. If you have not joined our mailing list, please do so using the link below, and we will also drop that into the chat for you, as this allows us to keep you updated with the latest news and also key dates. So thank you very much for listening, and we have time now for your questions. Okay. I'm going to stop sharing my screen a moment.
Someone is asking about applying for a deferred application.
Yeah, and I can see that Dawn is typing an answer, but the expectation is that applications are for entry in the 2024 academic year. Once you have an offer for 2024, it's possible to request a deferral to 2025. So you cannot apply for 2025 directly. You can apply for 2024 and then make a request to registry for a deferral to 2025.
Could I just add to that we can only defer once? So if you were to apply for 2024-25 and then wanted to defer, you could do that, but you could only do that once. So if for any reason you couldn't join in 2025, you would have to reapply.
Great.
Does that answer your question? I hope so.
Yes, I'm sure David will respond back if he has further questions.
With regard to there's a question about the scholarship asking if it applies only to full-time or does it cover part-time. I would expect, I'm sure that Jen will be able to correct me if I'm wrong, but I would expect it would apply to either part-time or full-time, but it would only be that fixed amount of £3,000. It wouldn't cover you. It wouldn't be £3,000 per year. Would that be right, Jen?
I'm just checking the details, actually. I believe it's for... it's only available to any people completing the full MSc. I can confirm that.
Yeah, but it would also be part-time. That would be okay, wouldn't it?
Oh, true.
I think.
Sorry, yeah, exactly. For the full award,
Yeah, as long as it's the MSc and not just the PG, the postgraduate diploma or certificate, it would apply whether it was full-time or part-time, but it would only be that one amount.
Right.
And then somebody else has asked, do we have programs for asylum or refugee doctors?
We have scholarships, so there is the Sanctuary Scholarship, which is full tuition fees and a stipend of, together with a stipend and an equipment grant. And you would need to search for that on the Imperial College website. I might see.
I'll put a link to that in the chat.
Yeah, the Postgraduate Sanctuary Scholarship. Right. Scroll down. we have any other questions either in the chat or perhaps if anyone's feeling brave enough to raise their hand.
Hi, Krish. We've noted your comment there in the chat. Did you want to speak instead of type? Feel free to put your hand up if so. Okay, Krish, we'll wait to hear from you. We've had a couple more questions there, Leanne, if you're okay too.
Okay. Right, so there's another sort of topical physiology question, which we'd be delighted to answer if you come and join us on the MSc. I'd like to keep this focused on questions about the MSc. So the next question we have is from 25 selected students, are there specific considerations in accepting them, like their previous clinical experiences, research, or other? There are no specific considerations, and once your application, if we've invited you to interview, then the considerations would be based upon your performance on interview. Oh, we've got some raised hands. I can't. Let me.
Krish, yeah, I'll allow you to talk, Krish, and if you could unmute for us.
Hi, Krish.
Hello.
Hello. Do you have a question?
Yeah, can you hear me?
Yes, we
Yes.
can.
Yeah, apparently I did apply for the part-time MSc in 2022, but it has been rejected. The feedback which I received was my supporting information wasn't enough. So how can I improve? Is there anything how I can add for this year to write the supporting information?
So there is information available on the college website about what makes a strong personal statement. Let me see if I can find a link for that for you now. So the personal statement is really where applicants can demonstrate their enthusiasm for the topic.
Okay.
Why do you want to come and study the MSc, particularly?
Mhm.
Why do you want to come and join us at the National Heart and Lung Institute? And also for you to explain how the professional and personal skills and attributes that you have will allow you to meet the requirements
All right.
of the
Okay.
course. Okay, and Imperial does have detailed information for applicants on its website, and I'll see if I can find that link for you now, or maybe.
Right. Thank
I'll
you.
look for that, Leanne.
Yeah.
Thank you.
Anybody else? Okay.
I think we're done. Great.
I think we're done. I know sometimes questions arise as soon as you click leave and you all go away. In which case, please do email us on the MSc inbox, and Dawn and I will be delighted to answer your questions by email. Otherwise, thank you very much for joining us today, and we look forward to reading your applications.
Thank you very much, everyone. Bye-bye.
Thank you, everyone. Bye.